Thank you, Mr. Chairman, and thank you for this hearing. This is, I think, a historic moment, really sort of kicking off the dialogue and effort that this country is about to embark on to really rise to a generational challenge and fix our healthcare system. And all the testimony and witnesses have been just terrific this morning. I wanted to focus on the issue of pre-existing condition exclusion, which Mr. Pollack referenced in his testimony. We have a bill before us, 1588, which basically would abolish pre-existing conditions across the board. And again, in our research for this legislation, which determined that 45% of Americans have a chronic condition of one form or another, 26 million Americans are enrolled in the individual market, where there is basically no protections to speak of in terms of the really just harsh discrimination that is applied towards individuals. Obviously, this is an important issue for our committee because it goes right to the heart of our ERISA cognizance. And one of the things that's happened since this bill has been filed is really a gusher of outpouring from particularly provider groups who have to deal with this issue day in and day out basis. The American Heart Association submitted a letter this morning, but the one that really took my breath away was the National Association of Obstetricians and Gynecologists, who talked about the fact that in many instances a woman who has had a past cesarean delivery is treated as someone with a pre-existing condition, although the likelihood of that resulting in any chronic cost is almost zero, as my wife would attest. And domestic violence victims are also sometimes subject to pre-existing condition exclusions. It's barbaric. I mean, there's really no other way to describe the way this operates. And Mr. Pollack, just again to walk through the state of the law right now, because HIPAA in 1996 made a partial effort to address this issue. Some people feel that the group market is basically sort of, solved the problem, but in fact, there really were gaps left in the group market as far as individuals being still subjected to it. And again, particularly with life-threatening chronic conditions, it sometimes can be just devastating. Again, I just wonder if you could reiterate again the fact that we do need to address that end of the market.
Well, there's no question that HIPAA left a lot of gaps. It did provide guaranteed issue for those people with continuous coverage. Of course, it didn't do anything about regulating premiums. And so you can be given the benefit of guaranteed issue. But if then you're charged an arm and a leg because you've got a pre-existing condition, that's not going to make coverage really truly available for you. We can actually go over the litany, by the way, of what constitutes a pre-existing condition. We came across a pre-existing condition exclusion because somebody was too short. We really can give you a number of examples that take this to the point of ludicrousness. But so I think in terms of HIPAA, obviously we've got to do something to make sure that when somebody is guaranteed that it can be issued to them, it's issued at an affordable price, and there needs to be some regulation of underwriting. In addition to that, as I mentioned, and that's very important with your legislation, is that you can provide essentially underwriting for an entire company. If that company has got a significant number of people, or even perhaps if it's a small company, even one individual who's got a major health condition. And even though employers are not supposed to check with their prospective employees what kind of health conditions they have, obviously it's going to make them very conscious of this. And so this is something that clearly needs to be corrected.
Right. And when HIPAA passed, when obviously the huge question was begged, well, what about the self-employed and the individuals who really have virtually no protection? The answer back then was, well, we'll have high-risk pools that will be out there at the state level to sort of pick up people who, again, have these conditions. Mr. Braun, I don't know if your organization has had much experience, but I suspect you might have in terms of what how those have operated.
We haven't done a comprehensive study, but they don't work. The rates get very high, very fast, and they've covered very, very few people, and we need a national solution. It just isn't working.
High-risk pools really have not worked. As Bill just indicated, there's very, very tiny portion of the population are in the high-risk pools. They're often tremendously underfunded. A lot of people who you might think qualify for a high-risk pool never get in. They're on a waiting list. And these high-risk pools really don't do much in terms of dealing with getting the premiums down. And so those two are underwritten in such a way that the costs are, for too many people, unaffordable.
The gentleman's time has expired. We very much appreciate the gentleman's leadership work on pre-existing condition issues since the day he first got here to the Congress. We're pleased to recognize the gentleman from California, Mr. Hunter.
Thank you, Mr. Chairman.